Okay, hello everybody. Welcome to another episode of What's Next After BDS. Today I have with me Dr. Vaishnavi Prabhakar, a colleague whom I met recently, and she's going to discuss about OFP, probably a new specialty in as a part of dentistry. So, ma'am, can you please give a short intro about yourself?
I am Dr. Vaishnavi Prabhakar. I met Dr. Vinay in one of the courses that we had joined together. Very nice meeting you, Vinay. And I am a prosthodontist, and I took up orofacial pain and completed my master's and then a diplomate of the ABOP and practicing in Chennai. That's about it. That's all I have done. And I'm currently doing my PhD in temporomandibular joint disorders.
Oh, that's nice to know, ma'am. Okay, ma'am. So my first question would be, before that, I would also like to tell people that I am also currently doing the fellowship in OFP, and after doing, or probably I'm still a part of the program, so I could see a lot of me approaching the case or the patient in an entirely different way. But since ma'am has finished the diplomate, she would be able to explain in a better way. So, ma'am, so why OFP first? So, how did you, what made you feel like you should join this course in the first place?
See, I was very fascinated with temporomandibular joint disorder as a postgraduate by itself. So it is a very interesting field for me. So when I took up orofacial pain as a fellowship course, it was basically an approach to learn more about temporomandibular joint disorders. Then as it went on, I realized there is more to pain in the face rather than just temporomandibular joint disorders and dental pain. So then the whole, slowly the whole part of the orofacial pain started sinking in, and now I'm completely enjoying it.
Okay. So can you briefly tell us about the course you finished, ma'am? The orofacial pain course.
So I've done the orofacial pain course from with Dr. Thomas in Smile USA. It is a very comprehensive program on the clinical aspects of facial pain and understanding how to each and every step and how to examine the patient and the history taking. It is not easy to diagnose a patient with an orofacial pain syndrome or a symptom or a clinical feature because it requires a lot of steps and a lot of grilling and a lot of training for us to understand the subject basically and then to diagnose a patient. So every patient who walks in, we initially before the course, either it was a psychological patient or it was a temporomandibular joint disorder pain or a dental pain. Now we get after the course, you get to know a lot of things about other pain syndromes that is happening in the face.
Okay. So it
is a very clinically approach useful and a comprehensive program.
So it actually changes the way you even see the patient, right, ma'am? So
approach, yes, it completely changes. Yes, correct.
Okay, and how can you justify, not exactly justify, how can you elaborate about the clinical importance of OFP now? Suppose a person coming from a dental background versus a person coming from an OFP background, right? So when he approaches a patient, so how exactly will it alter his approach to the patient?
See, when you're a general dentist and when you approach a patient with pain, we are very narrow in our process of thinking. We tend to think everything is related to occlusion, and we tend to think everything is related to the dental issue that is picking up the pain. So when it comes to an OFP practitioner, you will broaden the view, and when a patient with pain walks in, you will also give importance to the underlying musculature, the gums, the nerves, and the surrounding structures, and even the central nervous system that plays a very important role. So the whole step-by-step process changes. The process of you thinking and looking at a patient completely changes. And you really understand and empathy the patient that who's going through several doctors and then lands in your clinic. And that way you tend to help more and you literally understand the patient better. So that is a very important thing that I learned from the program, and I've learned as orofacial pain practitioner. Right now, I tend to help more people because the understanding is better than a general dentist, and it is a beautiful link between medicine and dentistry. That is really, gives us a better stature when it comes to dentistry and understanding your patients.
So as you say, there's a good link between medicine and dentistry. So that means it also expects you, or rather asks you to stress on the medical history of the patient, right? Thereby,
Correct.
usually we just
Correct.
ask the question, patient, what medications they are up to, simply because
Correct.
we want to see how it affects our treatment. But here, I believe you focus more on the medical history.
Medical history. It's a good link between medicine and dentistry.
Yes, ma'am. Exactly. And one more question is like, suppose a patient who has an orofacial pain, and so how, I mean, I'm asking like a commoner, like what makes him think that he has to come to a dentist for the same, right? So in general, the public view is like, to me, it's only teeth or whatever we have the other. So how can an OFP related disorder come to a dentist?
So that is why it has become a recognized specialty in the US. Okay. In India, it's just in the very emerging space. We are in the beginning of the change. So for a medical practitioner to understand these conditions is better because we are more focused on the tooth. We focus from the beginning to the end on the tooth. So as the patient understands that you know better than your other fellow dentist, I think the whole perspective changes. And as the knowledge is shared and as the specialty is being promoted, people would understand better that orofacial pain specialists can handle these disorders, unlike a medical practitioner also. So that awareness should be created. That will take some time. It will take a few years. It has just become a specialty in 2021 during the pandemic, and it will definitely take a while for the whole specialty to catch up. It is not 1 or 2 days process. So it will take a few years for the whole specialty to catch up.
Like how implant was an emerging specialty in the early millennium, like so we can probably OFP is an emerging specialty currently.
Correct.
Ma'am, if it's okay with you to share, can you just tell a quick short case of how OFP helped in your diagnosis, somewhere which your usual dentist wouldn't have thought of, if it is okay with you? A very short case, maybe 30 seconds or something.
So every case has been very different. The last case was just a few weeks, 2 weeks back. So that lady was a 35-year-old lady, and she's had severe pain and in her face and joints around her body. So she had approached 40 other practitioners, including 10 dentists, 10 neurologists, 10, I don't know, many. She said 40, and she had a big bag. And she was completely frustrated. So with the history taking, I take it very slow. Meaning I take a couple of appointments before the patient actually trusts you. So after the first or second appointments, we split the diagnostic process, and I took 2 appointments and really went through her system and realized she has a temporomandibular joint disorder pain apart from a musculature pain. And later, slowly, when we went into testing, we realized she tested positive for SLE, lupus erythematosus. And even though it was a shocker for her, she was like, "Madam, you're the only one who gave me a single test and got it positive." So that knowledge had acquired over, I think, 5 years of training, not 1 year of training or 1 hour of training or 1 hour of course. That will not come in 1 or 2 hours, of course. So this lady, even though she had a diagnosis that it was SLE and she had a TMD pain and severe musculoskeletal pain, and the second appointment, she lit up. She was brighter than the previous appointments because she was very depressed. She didn't know what was going on. She thought she was imagining, and she was labeled psychiatric. She had been to at least 5 psychiatrists, and she was on around 100 drugs. She had been over several drugs for the last 5 years, 30 years on her. She started having this chronic pain all over her body, and she was labeled psychiatric. She was under at least 5 psychiatrists. So the whole mental stability was poor, and the family was not coping well. The family was thinking she was creating things to create self-pity. And when she had the diagnosis, even though it was not a very positive thing to look at, but she took it in a very positive way. She's so happy that she could define her problem and validate what she's going through. So that was a great case for me. Apart from several other cases where we were able to narrow down very tough diagnosis. But this one was very special to me because this is the last one I remembered. And this lady, instead of feeling sad, she was happy. She's like, I can justify myself. then I can tell my colleagues and my parents, and I could. So that was quite a very interesting case for me.
Okay. So as mentioned earlier, it expects you to focus on a lot on the medical history. Thank you so much for your valuable time, ma'am. I'm sure people looking forward.
Thank you.
And you would like to add on something, ma'am, just before we conclude?
I would like to wish all the budding dentists very best. I know it's quite a struggle in India to be a dentist and to survive in such a tough environment where there's a lot of competition. But it requires you to find what are you passionate about, and when you find what you're passionate about, you have a motivation that you're getting driven towards. So find your passion and work towards it, and I think you will flourish very well in the future years.
Okay. Thank you so much, ma'am. And is it okay if you can share your email ID at the end of the video if somebody wants to?
Sure, Vinay.
Is it okay?
Sure, Vinay. You can do that. Okay.
Thank you so much.
Thank you so much, Vinay.
Nice talking to you.
Yeah, thank you. Nice talking to you.